and urinary. Okay? So as you get older, you know, your digestive system is also affected. So the digestive system includes the esophagus, stomach, large intestine, short intestine, and also a rectum. So, wait a minute. So your mouth, esophagus, stomach, small intestines, large intestines, and your rectum. Okay, so the food is usually digested in the mouth. Okay, simple carbohydrates like bread, sugar is digested in the mouth. Whatever is left, it goes down to the esophagus, which is the tube that connects the mouth and the stomach. So tube. The stomach is where all digestion, or most digestion, takes place. So whatever is left is turned into chyme. And is passed on to the small intestines, where fluids are usually absorbed by the body or metabolized. So whatever is left goes to the large intestines, where the last part of the digestion process takes place. And then whatever is left or byproduct is stored in the rectum, which is what you call the feces, or where the feces and the stool is stored. Okay? So the digestion takes place in the digestive system. So from the mouth all the way to the large intestines, and then whatever is left or the byproduct is left in the rectum. Okay? Did you guys talk about different problems with digestion?
No.
Like diarrhea?
No.
Really?
Touched on it in that.
Okay, so there are different types of, there are different problems as we get older. Okay? A lot of the times, these are very, very common. Like, for example, you're at risk for constipation. Okay? So as you get older, you're at risk for constipation because you don't drink enough water, you don't eat enough fruits and vegetables, low fiber. So decreased fluids, and also decrease in fiber. Okay? So your main goal as a nurse is to make sure the patient is well hydrated. So normal hydration should always be, for women, should be 1.5, at least 1.5 to 1.8 liters a day. Okay? For the guys, for men, should always at least 2 liters a day. I'm not saying give them water all the time, Like for example, milk, juice, what else?
Gatorade.
Coffee, what?
Gatorade.
Dairy?
Gatorade.
Lemonade.
Actually,
Sugar-free.
Gatorade, not really.
Really? Why?
Unless you're like dehydrated.
Yeah.
Yeah, I'll explain later, because Gatorade has a lot of like other what do you call that? Electrolytes. Yeah,
But
that
isn't
you don't-
constipation the result sometimes of dehydration? Why wouldn't you?
No. At first, no. A lot of times when you get older, you don't walk. You're constipated. When you take narcotics, pain medication, you get constipated. When you take a lot of medications like psychotropics, you get constipated. It's not because of you're dehydrated. But also that can be a factor. But you don't really give Gatorade to patients unless they're dehydrated. Okay? Because it might be a problem with their electrolytes. Sometimes you might have too much calcium in your body or too much potassium, and then you give them too much potassium, makes the potassium go up. You can get like a heart attack. Yeah, so be careful with whatever you give. It's better to give just water. But if you can't give water, then give like milk or coffee, because coffee got water. Just don't give them alcohol because alcohol has a drying effect you become more constipated. Okay. Another problem with the digestive system is what you call fecal impaction. So usually when you're constipated, it leads to fecal impaction. When your poop is stuck, you don't get out. Okay, so that's why they have these, ways to treat it using enemas and what do you call that, suppository. Okay, because if you don't fix the fecal impaction, it can lead to perforation. You can perforate the colon or the rectum, in which case you're going to need surgery, and if you don't get surgery, you're going to die. It's because of the infection. Okay? So, there are different types of enemas. The most common one would be water or tap water. So basically you need tap water from the tap, and then they put it in the enema tube, and then goes to the stomach, the rectum. It cleans all the poo-poo, and then it comes out. That's the most common one. There's also what you call soap suds. You put soap, and then it cleans the rectum. There's also what you call...
what kind of soap? Like dishwashing?
No, not dishwashing.
Hand-washing?
Usually it's commercially prepared.
Oh, it's like
Because for example, let's say you're gonna have like colon surgery.
Oh, yeah.
They want to make sure that it's clean,
Yeah.
because if you don't, there's gonna be infection.
Mm-hmm.
So for example, let's say the person has like a tumor in the colon, like colon cancer.
Yeah, just
Usually
the
they give
solution
enema.
that they have.
Yeah, it's a commercially prepared.
Yeah.
But the other one is fleets. So fleets enema is like a tube, like this is too big.
She showed us yesterday.
It's
And
behind
It's
you.
behind
You
you.
showed us yesterday.
Oh.
With that red bag, it's attached to that red bag, isn't it?
That big red bag back there?
No, this is not fleets. This is an enema.
No, but it's right. I think it's back
No, it's underneath it. It's in a box.
in a box in the back.
This one.
Yeah.
Fleets enema. The one that gives this is the nurse. The soap and tap water, that's the CNA. Okay, so in order for you to get rid of the fecal impaction, you gotta do these, or else you gotta do surgery. But usually we try to avoid this, because usually the elderly, if you gotta give them surgery, they have to take anesthesia, and usually it affects them a lot. Sometimes they don't get, they don't survive surgery. So we gotta do the least invasive. Okay, besides constipation, fecal impaction, there's also flatulence. You guys talked about this?
Mm-hmm.
Flatulence, excessive gas formation. And then also diarrhea. Okay, so this is when you have liquid feces. Alright, so these are the problems with the digestive system. You guys clear? So whenever the person has flatulence, usually they give them like a rectal tube. You know what that is?
What did you say?
Rectal tube.
Oh.
And then for diarrhea, they give meds. But you got to be careful. Usually, they don't give meds when the patient is having diarrhea, because you can get like a megacolon. Okay, that's one of the side effects.
You can get a what?
Megacolon. Your colon gets inflamed, gets big. So that's why they want to make sure before you give anti-diarrheal meds, to make sure that it's not an infection. Like for example, C. diff. If it's C. diff, then you got to treat it with antibiotics. Okay, so you want to make sure you don't get megacolon. So for the genitourinary, Okay, so genitourinary, that's this one. Okay, so this is a system that produces urine. Okay, so part of the genitourinary system would be the kidneys, the ureters, the bladder, and the urethra. So the kidney produces urine, it filters the blood, produces at least 30 cc's of urine per hour. So a total of at least 480 cc's a day for a normal person. The ureters is the tube that transports the urine to the bladder, which stores the urine. So the bladder can hold up to 1,500 to 2,000 cc's of urine a day. But your body is built in which if you have like 700 cc's or 800 cc's, the brain tells the bladder to go to the toilet and go pee. The problem if you don't pee, your blood pressure goes up. Okay, so for people that have, for example, if you had a stroke or if you have like traumatic brain injury, wherein you lose your functioning, your what do you call that? The spinal cord isn't working from the waist down. Usually, what we do is we straight cut the patient, or we leave the Foley catheter in place. Because if your bladder is full, it can cause high blood pressure, and then you can have problems like strokes, heart attacks. And then the urethra is the opening. This is where the urine comes out. So as you get older, there's problems that arises in the genitourinary. So number one can be incontinence. Okay. Same thing with the GI tract. You can get urinary incontinence. The GI tract you can get fecal incontinence. Incontinence means you lose the ability to control. So it just comes out. Okay, when you cough, it comes out. When you sneeze, it comes out. This is very common with the women. Because, as you get older, your Kegel muscles, they're gone. So that's why they teach you, before you have a baby, you should exercise your muscles. Remember? Did they teach you that? Mm-hmm. Okay. You don't have any children, right? No,
I don't know what you're talking about.
Yeah, they teach you this when you're having kids. Because if you don't, it just comes out. Like for example, sometimes you can have like a vaginal prolapse. You guys ever heard this? Yeah, and also the uterus. Yeah, man, this happens.
I am aware.
Okay. What you're gonna do, for example, if there's a vaginal prolapse, so all you gotta do is just wear gloves, put lots of KY jelly, and then just gently push it back. It'll suck it in.
Really?
Mm-hmm.
A little shove in it.
Just support it.
I've had to do that.
Did you tell her to take a deep breath in, or?
No, it just goes up.
What?
Yeah.
It just pops right back into place?
Just like,
Yeah, it just goes back. Because
Yeah.
you can't control it, that's why it came out. So what you gotta do, put lots of KY in your hand and then just kind of like support it,
yeah,
and then it goes
The
up.
CNA does that?
that's it.
Well, I did it before.
I've done
the
it.
CNA can do it because it's not an invasive procedure. You're not gonna like push it in.
No.
Okay, but before it was gross at first. I said, "Is that shit?" I thought it was poop. It's different. I said, "Oh." And then you just push it back out. You just support it. Okay. And then the last part that I'm going to explain. I'm not going to talk about reproductive system because when you get older, you don't care anymore. Okay. The end.